Welcome to the first ever webinar organized by the Evolutionary Psychiatry Special Interest Group at the Royal College of Psychiatrists, EPSIG. I'm Riadh Abed. I'm the previous chair, currently finance officer of EPSIG. This event is also co-organized by the Evolutionary Psychiatry section at the World Psychiatric Association. EPSIG has unfortunately been in a dormant state during 2020 due to the pandemic, and we've had to cancel two major face-to-face conferences, one half-day and one full-day symposium. We've been somewhat slow to adopt the virtual conference format. Today's webinar was originally planned as a whole day face-to-face conference, but when we changed it to webinar, we decided to make it a half day and make it free of charge and open to all. Unfortunately, due to the new rules by the Royal College of Psychiatrists, we won't be able to offer future webinars free of charge, but we'll try and keep the registration fees as low as possible in the interest of wide participation. And just to plug some future events, we're planning a webinar type lecture on the 11th of June. We have a guest speaker, and the theme is going to be that of the social determinants of health. We also are planning to go ahead with our whole day fourth international symposium on evolutionary psychiatry on the 29th of October. If the regulations permit, we will have that as a face-to-face conference at the college headquarters in London. We have 6 keynote speakers already scheduled for that meeting, and they are leaders in the field of evolutionary psychiatry and psychology. We will obviously have it as a virtual meeting if the regulations don't permit. Also, we are looking forward to the publication of a major edited volume on evolutionary psychiatry, which is going to be co-published by Cambridge University Press and the Royal College of Psychiatrists, with chapters by leading evolutionists from around the world, and we hope that's going to appear in print in 2022. So if you're interested in the subject, you can look out for that. So it's my great pleasure to open today's webinar titled The Evolutionary Roots of Attachment Theory. We have a brilliant lineup of speakers. And there should be time for Q&A. There are 2 boxes that you can use to make comments or submit questions. There's a chat box that you can make comments on, which you can discuss matters as an audience, that is, with fellow attendees. And there's a Q&A box that you can submit questions specifically meant for speakers, and the chair of the session will summarize these and put them to the speaker after they finish their lecture. Also, there's a slight change in the program where the sequence of the talks is going to be altered for the second half of the webinar, where Jeremy Holmes is going to go first and Martin Brunner is going to be the last speaker. So John Bowlby, the originator of attachment theory, repeated many times in his writings and interviews that the origin of attachment theory lie in psychoanalysis and ethology. And of course, ethology, the study of behavior is an offshoot of evolutionary biology. However, my guess is that many, if not most psychiatrists, when they think of attachment, will think of psychoanalysis and forget about the fundamental evolutionary origins of this. So today's webinar is not only about reclaiming the evolutionary origins of attachment, but also demonstrating that this profound theory that goes to the heart of human nature would not have been possible or would not make sense without evolution. Bowlby himself acknowledged the profound influence of the writings of Konrad Lorenz, but above all, the ongoing influence over many decades of Cambridge ethologist and evolutionary biologist Robert Hind, who helped shape Bowlby's thinking along evolutionary lines. So to turn to today's webinar, it's my great pleasure to introduce our first speaker, Dr. Annie Swanepoel, consultant child psychiatrist in the UK. Annie is author and co-author of numerous evolutionary articles and reviews. She is founder member of EPSIG. She is also the current EPSIG Newsletter editor. Annie's title today is Understanding Child Development from an Evolutionary Perspective. So over to you, Annie.
Thank you very much for that introduction. So I'm interested in an evolutionary perspective on child development because I think it really contributes to the biopsychosocial understanding. And we used to ask what is wrong with a child, a pathological kind of approach. And with a trauma-informed approach, we have learned to ask what happened to the child. And an evolutionary view helps us understand why children develop the way they do. It helps us to see which behaviors are pathological and which are adaptive strategies. In other words, many of the children we see in practice have developed evolutionarily sound strategies to cope with a harsh environment. And recognizing this can help children, their families, and their clinicians reduce shame and blame. Tinbergen's asked 4 questions, and I think in child psychiatry we make the mistake of only focusing on the first 2. So we think about how does it work and how did it develop. But where we miss a trick is to think about how is this behavior adaptive? What is the survival value of the behavior? And it's clear that nothing in biology makes sense except in the light of evolution. And in this talk, I want to introduce 4 evolutionary concepts. The first is parent-offspring conflict. And what that tells us is that what is best for the parent is not always best for a particular child. And this conflict can explain a significant amount of parental child abuse and neglect. So parents, particularly mothers, had to make difficult choices when resources were scarce. For many mothers throughout our evolutionary past, it was not possible to provide for all their children all of the time. A baby whose mother was not committed to their care was in life-threatening danger for the most part of our evolutionary history. For example, if a baby was born when the older child hadn't been weaned yet and the mother didn't have enough resources to look after both, and that may have led to the baby being left to die. So maternal preference for a sibling could result in death when resources were scarce. And those babies who responded in ways to keep their mother's attention and care, and therefore survived and reproduced, are the ones who became our ancestors. And that explains why babies are so demanding and why sibling rivalry is so widespread. Charles Darwin wrote in The Origin of the Species, "As many more individuals of each species are born than can survive, and as consequently there is a frequent struggle for existence, it follows that any being, if it vary however slightly in any manner profitable to itself under the complex and sometimes varying conditions of life, will have a better chance of surviving and thus be naturally selected." So from the strong principle of inheritance, any selected variety will tend to propagate its new and modified form. Please note that Darwin has recognized at the time that nature is quite brutal in the sense that so many young are born who never survive, but that is the way things work. And life history theory explains this further. So in harsh conditions, there's a trade-off between short-term survival and reproduction at the cost of longer-term health and happiness. The way I think about that is by looking at different species. So if you consider elephants, they follow a slow life history. So these individuals defer reproduction, tend to have fewer offspring in whom they invest considerable resources. So the focus is on quality. In the nature, previously, there weren't predators that killed elephants. So it worked to have few offspring because they had a good chance of surviving in adulthood. And this slow life history is adaptive in a benign environment. However, the other side of it is fast life history. So individuals begin reproducing at a young age, tend to have more offspring, each of whom gets relatively little nurturance. So the focus is on quantity rather than quality. And if you think about rabbits, they get lots of little babies, but in nature, many of them are caught by foxes and other predators. So if they only had one baby, like elephants did, that baby might not survive. So a fast life history is more adaptive in harsh and dangerous environments, where many young are expected to die. So if we think about this in terms of people, in harsh environments where there's lots of poverty, community disruption, a lack of opportunity, poor housing and violence, if there are adverse community environments, that leads to a harsh rearing environment for children. So where there's more mental health problems in parents, more maltreatment of children, and an increase in adverse childhood experiences. And dangerous environments lead to a mother being fearful and being less able to provide sensitive and warm care. And even in pregnancy, the stress hormones that the mother experiences calibrate the HPA axis in the unborn fetus to shape fear reactivity. And that results in hypervigilant and fearful young. So fetal programming prepares the infant for the type of postnatal environment it is likely to encounter. And I think this is key because as a child psychiatrist, I understood all of this. I knew that all of this happened, but I had not understood why until I read more about evolution. So that there's some reason for why babies are so sensitive to the mother's stress hormones. It is because they are likely to be born into a stress-inducing, dangerous environment. And that is adaptive, even if it causes considerable suffering. And we know that the stress hormones don't just act on the brain, it acts on the endocrine system, on the heart, on the whole body really, the immune system, so that it has long-term consequences, chronic stress. And if we look at the adverse childhood experiences, we know that that leads to disrupted neurodevelopment, social, emotional, and cognitive impairment, and later on to adoption of health risk behaviors, disease and social problems, and an early death. And this is akin to the fast life history. But it doesn't stop reproduction and survival, and therefore there's this intergenerational transmission of trauma. So the third concept I want to introduce is that of the goodness of fit or conditional adaptation, and I want to refer to attachment theory, where successful survival depends on the ability to predict and adapt to environmental demands. So for example, in dangerous environments, it's adaptive to trust no one. John Bowlby and Mary Ainsworth developed attachment theory, And for those who are perhaps new to this, attachment refers to the bond of the infant to its primary caregiver, who's usually the mother, and later toward meaningful others. And this bond is necessary for mammalian newborns because they cannot survive by themselves, and they need to be close to their mother to protect against predators, and it provides a secure base from which the infant can explore and return to if frightened. And it's important to note that children can form multiple attachments if given the opportunity, so if they have multiple caregivers. And where mothers have enough physical and emotional resources, so if they are in a benign environment, they can provide sensitive and responsive care. And this leads to infants developing a secure attachment in which they believe themselves to be worthy of care and others as capable of caring for them. So again, if you think about the slow life history, where a lot of investment is made into the individual. But it's really important to note that nature does not prepare babies only for the optimum, where they are loved, wanted, and sensitively cared for. Children develop attachment relationships even if their caregivers are rejecting, inconsistently sensitive, or abusive. And Mary Main proposed that the attachment system would need to be capable of calibration to a variety of environments, favourable and adverse. So sensitive caregiving is optimal, and the provision of a secure base would help a child to explore and learn. However, less sensitive caregiving could be expected to elicit responses that would support survival even in adverse conditions. So, for example, in insecure, anxious avoidant attachment, mothers who are dismissive of the infant, who might have lots of other things demanding their attention, have babies who learn to become as independent as possible in order not to antagonize a rejecting mother. And these children develop an avoidant attachment, which I think about like Clint Eastwood as a cowboy. It's characterized as being compulsively self-reliant and not showing their stress. This is important to note. They are very stressed if you measure their stress hormones, but they don't show it because they have learned that crying might antagonize a mother who's rejecting. And it's important to recognize that an avoidant attachment is not pathological, and it is adaptive in the environment the baby grows up in. So the baby can get the most from the mother if they don't annoy her by needing her all the time. On the other hand, intrusive and inconsistent caregivers who are preoccupied have children who develop an anxious ambivalent attachment style and become compulsively care-seeking. So these might be caregivers who are able to provide sensitive care, but don't usually do it, or only do that when the child really seems to need it. So this is, again, not pathological. It's a style which allows children to get the most care they can from a caregiver who is able to provide good care at times when given lots of prompts by crying, whining, or clinging. Then the fourth category was described by Main and Solomon, which they termed disorganized, because these children would use unusual and odd ways of engaging with their caregiver. And the disorganized category is very prevalent in psychiatric patients, so probably 90% or more. And it is associated with care by a fearful or frightening caregiver whose own childhood is unresolved. Now, from an evolutionary point of view, you could argue, and Sarah Hrdy has done so, that in the past, these children would not have survived such adversity. So if they had a caregiver who maltreated them, they may very well not have survived. However, others have argued, like Altigan has argued, that freezing or attentive immobility is a functional response, which allows a protective role in high-risk contexts in which caregiver behavior might be potentially harmful. So a child just freezing, doing nothing, might be the best thing they could possibly do in a situation where they are at risk of abuse. And also, it's important to note that Pat Crittenden has developed the dynamic maturational model that obviates the disorganized category and describes it as extreme strategies of the previous two I discussed, the avoidant or anxious styles. And it is conceivable that in high stress situations, risky, last resort strategies may be adaptive in exploring alternative coping mechanisms to hopefully find a behavior that reduces the risk to the child. And I want to make it clear that in no way am I trying to blame mothers, because I do believe that mothers do the best they can. And we also know that babies really need such a lot of input that there is some truth in the saying that it takes a village to raise a child. And it has been shown that the involvement of a father in child rearing has beneficial and distinct effects on the child's neurobiological maturation and on the development of social competencies, particularly the child's capacity to manage aggression. And in many cultures, grandparents are particularly helpful in contributing to children's survival and helping them thrive. And multiple caregivers and a network of attachment relationships have been found to constitute a protective factor in child development, with secure attachment to one person buffering the implications of insecurity in other relationships. And I think that should give all of us hope who work with children who have really suffered, because even one good relationship can make a huge difference, can be life-saving. So in a benign environment where parents are well and have adequate support, they will provide sensitive and responsive care. Children will adapt to be open, trusting, and able to accept help. So that's the secure attachment, and that is adaptive in a benign environment. In a harsh environment, that is not adaptive, because if you're trusting people you shouldn't be trusting, you could get into very big trouble. So in a harsh environment, it makes much more sense to not have a secure attachment. And I'm in no way trying to say that it's conscious choice. It is just what happens, the way people react. So if parents are stressed due to ill health, poverty, having less social support, they may be less able to provide consistent care, and these children will adapt, like I've said previously, by becoming compulsively self-reliant or clingy and compulsively care-seeking. And these children will have highly activated stress systems, which mirrors their parents' stress and is adaptive to the more stressful environment. And we know that chronic high stress contributes to both mental and physical disorders later in life. However, reproduction is not inhibited, and thus the cycle is perpetuated with an intergenerational transmission of trauma. High stress may be adaptive and enable survival in harsh environments, even when coupled with considerable suffering. And a recent consensus statement said that unless the world is successfully engineered to become a responsive and safe place with plenty of resources for all of its inhabitants, it may not be justified to consider only secure attachment relationships to be adaptive for all individuals. And I think this is really important for us who work in child mental health, because there is this thought, this narrative that only securely attached children are normal, or that that's the ideal, and that everybody else has some pathology. And that is not the case. We need to be really quite careful about that. As Winnicott, or paraphrasing Winnicott, there's no such thing as a baby. There's a baby and someone. So attachment is about a particular relationship. It's not child specific. That's the other thing I've come across. It's not the child's characteristic in terms of their attachment style. It's about the relationship with a particular person, and children can have different attachment styles to different people depending on the care they receive. The focus on attachment can unhelpfully legitimate a narrow focus on the mother-child relationship and the responsibility of the mother for this relationship, thus directing attention away from the family socioeconomic context and the availability of social support. And I think that is also something we see. There might be a lot of evidence on parenting programs and not thinking about housing and food and all the other things which cause stress. So just bringing the bio, the psycho, and the social together. And some children we know are genetically more difficult to care for due to their temperament, their sensitivity, and underlying neurodevelopmental conditions. And other children are genetically easygoing and resilient. And we know that genes and the environment interact, so nature and nurture are important. And thinking about resilience, nature doesn't put all her eggs in one basket, so that there are always some who thrive, regardless of whether the environment is harsh or benign. And although all children show a degree of adaptability, some are more sensitive to the environment than others, and this is the differential susceptibility, and this is not a vulnerability. So just for those of you who may not have come across this before, the metaphors that are used, or the examples, are that of a dandelion. So dandelions are resilient, and they can grow anywhere. They don't need any particular soil or any particular care or watering. So in harsh conditions, dandelions are resilient, they pull through, and children, we know about children like that who live in the most awful situations but seem to be perfectly fine. In contrast, there are people who are very sensitive to the environment. They are like orchids. And in a harsh environment, if you look to the left of this graph, they don't do well at all because they need really sensitive care to do well. And I think the children we see in child mental health services are all orchids, because they are the sensitive ones who really struggle. But it's not just a vulnerability, because in a benign environment, if you go towards the right of the graph, the orchids can outperform the dandelions. So it's a different strategy, it's not a vulnerability. And then the last thing that I want to just briefly mention is mismatch, where current environmental demands do not fit with what we have evolved to cope with. And just to explain that briefly, as with the example of food, in our evolutionary history, food was always a struggle to come by. There were famines, people died, and our ancestors were the ones who were good at eating when they could find food and storing it as fat. And in our current environment, where cheap food with high calories is plentiful, that leads to widespread obesity. So that's just an example to illustrate evolutionary mismatch. In terms of children, I have previously given a talk on ADHD as an evolutionary mismatch, where we can see that throughout our evolutionary history, children were able to be outside, play, be active. And our current school environment, where we expect children to sit still for 5 hours a day, 200 days per year, is extremely abnormal. And the children who struggle with that are not necessarily the problem. It might be the whole situation that we are creating, which doesn't fit with what evolution has adapted us to cope with. So in conclusion, a secure attachment with a slow life history is adaptive in a benign environment. In a dangerous world, the pathway described by insecure attachment, predisposing to fast life history, is more adaptive in terms of survival and reproduction, even if it does create genuine suffering. And not all children are equally sensitive to the environment, and this is genetically determined to a large extent. Some are easier to care for than others. And further research into epigenetics and differential susceptibility might inform our thinking about which treatments might work best for specific patients, because it's important to note that the little orchids who are so sensitive to the environment aren't just sensitive to a bad environment, they also can do so well in a good environment. So we really need to focus on getting it right for those little ones, that they can flourish. A Acknowledging the importance of the early environment creates the potential to improve clinical outcomes by increasing the resources given for parenting programs and early child development support. Understanding the evolutionary context and gene-environment interactions can help patients feel less shame and blame if we can understand where we come from. An evolutionary view can give us a more sophisticated approach to psychopathology, enhancing the possibility of intervening more appropriately and with greater compassion. And I want to thank my co-authors with whose work this talk is based on, and all of you for listening. Thank you.
A question and comment by Steve Hyam. Good talk. How can we convince the rest of the mental health world to consider this? That's a big question, that, isn't it?
Well, I'm hoping that all of you who are listening who will spread the word. I am the editor of the EPSIG Newsletter, so that goes out to people, and then Riadh and Paul are editing this wonderful volume. So I think it's a matter of spreading the word. I'm very grateful to people who introduced me to evolutionary thinking, because it really helps make sense of things which I knew before, but it just didn't quite fit. And that is, so I'm hoping all of you will help spread the word. Thank you.
Great. A question or a comment by Desmond Bedolf. There was a recent article in Scientific American linking Bowlby attachment theory with insecure attachment and social media stalking. Any comments? No?
I haven't seen that particular article, but yes, we do know that stalking is related to an anxious, ambivalent attachment. So it fits with the thinking that you have to up your signal in order to get love. So you need to really make sure that somebody, you need to get their attention. And there are many different psychiatric disorders which have been linked with different attachment styles and with evolutionary thinking, particularly morbid jealousy. So there's a lot of information out there which is very interesting.
Okay, there's another question by Vaishnavi Soranaraj. Hi, thanks for the talk. You mentioned social deprivation as a stressor affecting attachment. I was wondering about difficulties in attachment seen in wealthier families, especially in the context of anorexia and disordered eating.
Thank you for that question. I had meant to say that it's really important with disorganized attachment to note that it's not necessarily based on the on maltreatment. So also when a parent responds and the parent is frightened, for example, if the parents suffered trauma themselves and they have a flashback or they have a dissociative episode, the child is frightened by that, even without maltreatment being performed or happening between the parent and the child. Now, we know that maltreatment happens in all social classes, so by no way am I saying it only happens in deprived societies. I think we all have seen many examples where that is not the case. Riadh will be able to say a lot more about eating disorders. That is his area of expertise. So shall I pass it to you, Riadh?
Well, I think time is running out. So, I mean, I don't want to take too much time on that. I'll just read the last question, Annie, but there would be other questions which, you know, maybe you could look at, and if you feel you can answer by text, then you can do that. So the last question is from Liana Romaniuk. Thank you for a really excellent talk. how can we best work with children who may have been fetally programmed for an adverse environment and are now struggling in a more benign one? And that's the last question.
Thank you. All we can do is to give children the best possible care and to understand when they can't take that on board, when it takes them much longer to adapt because they can't trust anyone. So it's around being that sensitive, responsive caregiver. And remember that children have plastic brains, so also all of them can change and will change. It's just about being patient and continuing to try and not give up hope.